Hi miss, my name is Ralph Christian Lin and today I'll be doing my return demonstration about Ngt Feeding. So let's start. Prior to Ngt Feeding, ensure that the tube is placed in the stomach. Coughing, vomiting, and movement can displace the tube in the correct position. So the position of the tube must be checked first prior to each feed, second is before each medication, third before putting anything else down into the tube, and last if the patient has vomited. So perform the following observations and obtain a gastric aspirate to establish tube position. First, ensure that the taping of the tube is secure. And second is obtain and document the position marker on NGT and compare to the initial measurements. And last is observe for any respiratory signs of distress.
Wash hands.
After washing your hands, you need to prepare the materials needed for the NGT feeding. And next is you need to provide privacy for the patient. And next is you need to explain the procedure to the patient. So, good morning ma'am, my name is Ralph Christian and I am your nurse for today. And today I'll be doing NGT feeding. So I'll be feeding you through your nasogastric tube. And after that, you need to wash your hands again. Apply clean gloves.
Measure the correct amount of formula and warm it to the desired temperature. Elevate the patient's bed to a high or semi-Fowler's position. Place protective sheet under tubing to protect bedding and clothes. Remove cup or plug from the feeding tube. Check tube patency and placement. Use the septo syringe to inject 10 to 15 ml of air. While auscultating with stethoscope, listen for bubbling or gurgling sound. Clamp the tube and attach the tube to the septo syringe. Flush with 50 ml to 60 ml of water as recommended. Pour the formula into the septo syringe. After you put in the formula, unclamp the tube. Allow the formula to flow in by gravity. During the feeding, keep the bottom of the syringe no higher than 6 inches above the patient. Continue adding formula into the syringe until the prescribed amount is given. If there are medications to be given, do not mix the medication into the feeding. Take note if the medication is to be given before or after the feeding. Crush the medication and mix it with water in the medicine cup. Pour the medication into the septo syringe. When the syringe is empty, flush the tube with prescribed amount of water. Clamp the tube. Leave the patient in high or semi-fallow position for at least 30 minutes. Observe after for vomiting or any unusualities. Discard soiled supplies in appropriate containers. So the post-procedure activity is the aftercare of materials, cleanse reusable equipment and rinse, allow to dry and wrap in clean towel to be used at next feeding. Proper documentation included verification of tube placement, amount of aspirated stomach content, feeding solution and amount, medications administered, amount of water administered, patient's response to procedure, instructions given to patient's caregiver, and last is the communication with physician when necessary.